Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professionals education. Now I'll point out to you in this series what's important, what's not so important. So let's go right to it.
Okay, welcome to the discussion of Chapter 8. Chapter 8 is Oral Examinations. It's in page 127. Okay, so oral examinations also included in this class because it is actually considered as a test of knowledge. Oral examinations are a test of knowledge, your knows and knows how levels in Miller's pyramid. Okay, it's also known as the viva, but if you recall our earlier discussion, and also in this chapter, oral examinations also include the long case examination. The long case is very popular here in Malaysia and also in other parts of the world as a high level clinical examination. It's usually part of the clinical component of examinations in medical schools. However, if you think about it, and also in this book, it is part of the knows how. It's a cognitive level assessment. It's assessment of your knowledge rather than your physical psychomotor skills. Okay, we'll discuss a bit more of that after this. And what are the characteristics of an oral examination? First is the interaction. It's face to face. Okay, there's an element of face to face between the examiner and the examinee. Okay, there can be examiners. There can be usually one candidate with a lot of examiners. It can be like that, right? And the question formats can be various question forms because people can use the basis of questions on patients, can be based on case notes, can be based on charts, alright, or just based on questions. And the length can be of various lengths. Can be just, as mentioned there, 5 minutes per session up until 1 hour, which is the typical length of the long case. We all remember long cases, right? Okay. And what are the purpose of oral examinations? The stated purpose is to explore the examinee's thinking, to explore further. What do we mean by explore? We want to see their skills such as critical reasoning, and problem solving, judgment, ethics, as well as the ability to express ideas, synthesize material, and think on one's feet. That's what's mentioned. Okay, so that is why we should use an oral examination. And we also have to think that the advantage is that we can follow up with probes, with further questions. And a candidate answers in one way, so we can follow up on that and say, why did you say that? Can you explain? Why don't you say this? And things like that. Okay, that is the advantage of using oral examinations, and that is when we can really probe and dig and know about their critical reasoning, their problem solving, their judgment, and their ethics, and things like that. The thinking process that goes behind. We can't do that, or whether it's difficult to do that if we use paper-based examinations. We cannot call the candidate for another session and point. Can you elaborate on this question and things like that? Okay. However, this is very important that the author, or rather the authors, clearly states things for which the oral examinations should not be used for, and those are things where primarily, if we want to primarily assess knowledge, okay, just knowledge, how much they know, how like even the higher order thinking skills and things like that. If it's just primarily that, without the communication skills, without the ethics, without the other things, then there are many other ways to do it. Other ways to do it better, more reliably, more valid, therefore leading to it doing it more validly, right, rather than using an oral examination. And the second thing, or the second area in which oral examinations should not be used for, is to evaluate elements of the encounter. You ask candidates to go and see patients just for the student, in order for the student to get an idea of the patient's story and things like that. But if you want to evaluate elements of the encounter, such as his history taking skills, his examination skills, and things like that, it is again better done in a simulation, in performance examination, in direct observational methods. That is the warning that is given by the authors regarding oral examinations. The authors then follows with examples of oral examinations used around the world. Okay, and they gave examples of oral examinations which are done well. Things like the DOSI. The DOSI is the direct observation clinical encounter examination. Okay, it is documented, it is reported in the literature, and there are findings regarding the DOSI, as well as the CAN-METS. They have documented and researched the use of oral examinations and they found it is used, for example, in the ITER, in training evaluation report and things like that, and as well as this CSR, which is the chart stimulated recall examination. Please read about it. And it seems that in the US, the specialty boards are also using oral examinations. I suspect long cases and things similar to that. Okay, because early on the authors say that oral examinations have a long history, a long tradition, and seems to be popular in the higher postgraduate kind of training, as well as the clinical examination. Okay. However, the authors follow up with a section called threats to the validity of the oral examinations. As if you recall, this is a recurring theme in the discussion in this book. Whatever methods they discuss, they will address the threats to the validity of oral examinations, right? Now, as usual, it is divided into the CU and the CIV, the construct under representation, and the CIV, the construct irrelevant variance. Okay, and under CU they mention that undersampling is a serious threat. Construct under representation or undersampling is a major challenge for oral examinations. It's serious, guys. Okay, and related to that is the issue or the concept of content specificity. What is content specificity? Is something that will come up again and again and again. I think we've discussed this previously. However, I will repeat. Content specificity means whatever you sample from candidates. Okay. For example, this is the universe of candidates' knowledge. For example, right? Knowledge, and this is the universe of his knowledge. Now, what we do in assessment is that we sample. We ask questions here, we ask questions here, we ask questions here. Okay, so for each question that we ask, the candidate's performance is related to that particular content, this area that we are asking about. Okay, and it is found that if the students perform well in this area, we cannot generalize. We cannot generalize it to other areas as well. We cannot say overall this student is good just because he answers well in this particular question, because we say that there is the element of content specificity. The performance is specific to that particular content. Alright, so we ask this question and his response or his performance is specific for the content in this particular area. It goes for any kind of assessment. You ask MCQs, you ask essays, you ask long cases, you ask the students to perform in the OSCEs, in whatever assessment, the performance is specific for that particular content and you cannot generalize. What you need to do, therefore, is to sample a lot of areas. The more areas you sample, the more or the better will be your generalization about this candidate's performance. That is the issue or the concept of content specificity, which is related to sampling. The more you sample, the better will be your idea about his overall performance. And now you understand why in oral assessments undersampling is a serious threat, because it takes time to conduct oral examinations. For example, if you just one long case will take about 1 hour or maybe more, right? So studies has found that if you just use long cases, you need about 18 cases in one study to arrive at a reliability which is similar to which is about 0.8 or 0.9. Okay, so it can be done, but you need to sample a lot, and that is the weakness or the Achilles heel of oral examinations. And some other problems related to construct underrepresentation is patient factors. If the skill, that particular area is related to a patient, then you need to ask students to see patients. Then patient factors play a role, such as patient's ability to cooperate with the student, whether they give consent or not. Okay, as well as the issue of comparability. Can you compare performance of student A who got patient A with the performance of student B who got patient B? So the element of comparability is not there, and therefore makes the results that we the decisions that we make based on the oral examinations suspicious or suspect. Okay, the other part of threats to validity is the CIV, the construct irrelevant variance, meaning the variance which is introduced, the differences between one student and the other, the marks which a student gets, which is not related to his competence, but rather introduced or related to other things. It's irrelevant to the construct. For example, here in oral examinations, it is found that in cases where a small number of examinees, small number of examiners per candidate, that is when the CIV is a serious threat. Why? Because let's say you just have two examiners per candidate. This is a candidate. This is examiner 1, examiner 2. If examiner 1 is very, very strict, then you need to have examiner 2 which is very lenient to be able to cancel out the effect of examiner 1. Okay, whereas if you have a lot of examiners, 3, 4, 5, 6, then any individual discrepancies, any individual characteristics of each examiner can be then cancel each other. So you tend to get higher agreement. Okay, decisions regarding this candidate. So in oral examinations, it tends to happen like that. There is a small number of examiners per candidate, especially in long cases and things like that. Okay, that can be a CIV threat. Okay, and what are the other things which influence candidates' marks apart from their competency? What are the variables? Things like mannerism and behavior. Well-mannered, professional, they have this aura, they have this good behavior, very polite. They tend to get more marks which is not related to their actual competency, but actually related to their behavior. Their language and fluency, the more fluent they are in their communication, the higher the chances they will get higher marks. Appearance, attractiveness, physical abnormalities tends to be negatively associated with results. Anxiety and stress, two equally competent candidates. One is relaxed, the other is stressed, so they higher chances for them to have different ratings. So these are the variables which contribute to the CIV threat to validity.